Assalamu alaikum, ladies and gentlemen, dear colleagues and fellow rheumatologists. The JAMS kinases are tyrosine kinases. They bind to transmembrane receptors type 1 and type 2 and mediate cellular responses to numerous cytokines and growth factors. The established and investigational uses of JAK inhibitors include rheumatoid arthritis, juvenile idiopathic arthritis, spondyloarthritis, SLE, psoriatic arthritis, inflammatory bowel disease, atopic dermatitis, alopecia areata, and vitiligo. Once JAK-associated receptors are activated, it leads to activation of signal transducers and activators of transcription called STATs. These STATs translocate to the nucleus of the cell and modulate transcription of effector genes. Cellular responses include proliferation, differentiation, migration, apoptosis, and cell survival. There are four isoforms of JAKs: JAK1, JAK2, JAK3, and TYK2. JAKs are orally active drugs and they are categorized as target synthetic disease-modifying anti-rheumatic drugs or TSDMARDs. It's a new class. And these TSDMARDs are designed to target a specific cytokine receptor, or another cell surface molecule. JAK inhibitors reversibly and irreversibly bind to proteins inside the cells, which prevents JAK from transphosphorylation occurring, and hence the associated cytokine and growth receptor function is inhibited. Tofacitinib binds to JAK1 and JAK3 in vitro and to a lesser extent to other isoforms. The inhibition of these JAK1 and JAK3 leads to reduced production of IL-6, interferon gamma, and type 1 interferons and other cytokines associated with JAK3. Tofacitinib has the FDA approval for use in rheumatoid arthritis, psoriatic arthritis, and ulcerative colitis. Internationally, it is available as Xeljanz, developed by Pfizer. In Pakistan, it is being introduced by Hirani Pharmaceuticals as Tofajak. Its dose is 5 milligrams BD. The review of data from numerous published clinical studies suggests that tofacitinib 5 milligram BD appears to have a favorable impact on patient outcomes related to efficacy and safety when it is compared with baseline values and with comparator disease-modifying anti-rheumatic drugs. JAK inhibitors like tofacitinib will have an important role in the treatment of our patients with rheumatoid arthritis and psoriatic arthritis. And thank you very much for listening and your attention.